So let's talk about all the symptomatic management of sexually transmitted infections, the kits, the contents, the doses, as well as if the partner treatment, what it is. The first kit is a gray kit. So this you have to just remember. The first one is a gray one, and it is all for discharges. So there's urethral discharge and cervical discharge along with painful scrotal swelling. So in this, remember, all the ACs in the house are gray. So there's gray AC. So AC stands for A is azithromycin, C is cefixime. Azithromycin is always given in the dose of 1 gram, whereas cefixime is always given in a dose of 400 mg. So this AC is always started once only in a house. So remember, gray AC, one, you just give it one dose stat, and you'll only give it to the present partners. In cervical discharge, however, you'll only give it if the patient is symptomatic. The second kit is vaginal discharge, and you can remember this is a green kit. How do you remember this? Is that vaginal discharge is that there's a trichomonas infection of the vagina which causes a green discharge of the vagina. So that's how you remember that the green kit is actually vaginal discharge. And you can remember this as the contents are, so now vagina is used for sex, along with there are people who keep having sex, so there's a sex flu. So you can just remember that sex stands for secnidazole and flu stands for fluconazole. So secnidazole and fluconazole. So secnidazole is always given in 2 grams, where fluconazole is always given in 150 mg. And all of this is again only given stat and only given when the partner is symptomatic. The third kit is a white kit. Now white kit, you have to remember, is a non-herpetic genital ulcer. So there are 2 kits for genital ulcers, the white kit and the blue kit. Both of them are non-herpetic as well, so they are not caused by any herpes reaction. Herpes is a viral reaction, so just remember that these are non-virals, they are bacterial infections. The blue kit as well as the white kit are for the bacterial infections. The white kit is for penicillin sensitive people, whereas the blue kit is for the people who have penicillin allergy. So you don't give you give a blue kit basically when there's a penicillin allergy in a person. So what is the content of the white kit? So remember, white is WAP. Okay, so WAP, I don't want to say the full form, but white is WAP. And in this context, the full form is A and P, which is azithromycin, and P stands for penicillin, which is the benzathine penicillin, which is used in a dose of 2.4 mu, whereas your azithromycin, as we already said, is always used in a dose of 1 gram. Both of that given. So when there's a genital ulcer, we'll give to all the partners in the past 3 months. So remember, ulcer is a serious thing, so you'll give it for the past 3 months to all other partners. You give it. So white, WAP, and given for the past 3 months. Coming to the fourth one, which is the blue kit. Blue kit is for the people who have penicillin allergy, and for that you have to remember this thing, blue is bad. Now bad stands for, B stands for blue, A stands for azithromycin, and D stands for doxycycline. So you're not giving penicillin, but you're giving doxycycline. Doxycycline is given in a dose of 100 mg BD. It's always given in a dose of 100 mg BD, but for this blue bad, it is given it for 14 days. And azithromycin, as usual, is given stat. Again, any genital ulcer is a serious thing, so you give it for the past 3 months. The fifth kit is the red kit. So the red kit is fifth, and red the R, so you can remember herpetic, the R in herpetic is very prominent, so that is for red. And this you remember because it is a viral, so you obviously give antivirals like acyclovir. Acyclovir is always given in a dose of 400 mg thrice a day. Okay, so morning, afternoon and night you'll give her 3 times a day 400 mg for 7 days. So remember, herpes is for 7 days. The incubation period is also for 7 days, and even the dose or the treatment was for 7 days. This is the only one where you do not treat the partner. For herpes, you don't treat the partner. It's an antiviral, you only treat the patient. The sixth one is a yellow. Now yellow is 6 letters, so you can remember the sixth kit is yellow. And yellow, low. The low of yellow is basically going to be for low, that is for lower abdominal pain. Now remember that to remember what are the contents of low, there are 3 contents. Is you have to remember that yellow it's a line of like yellow color is basically fixed metros and cycles. So in the city of Delhi, there are metros and there are cycles, and all of them are yellow in color. You can just remember this. It's very hypothetical. They are yellow in color and they are fixed timings. So you can remember fixed, metros and cycles. That is the yellow car contents. So fixed stands for cefixime, metro stands for metronidazole, and cycle stands for doxycycline. So cefixime is always given in 400 mg, metronidazole is also given in 400 mg, and doxycycline, as we already spoke about, is given 100 mg. Metronidazole is given twice a day, so is doxycycline. But just remember the catch over here is metronidazole and doxy, the metros and cycles, they run for 2 weeks. Okay, so you have to give it for 14 days, whereas cefixime you give it stat. Now in yellow, which is the 6th kit, you also treat the male partners with kit 1. So if the females are getting lower abdominal pain, you give the kit yellow, which is the 6th kit, but the males will get the kit 1. And the last but not the least is inguinal bubo, which is the 7th kit. Remember, bubo is the 7th kit. In this, bubo also stands for bad. So bad is the same content as we spoke about the blue kit and the black kit. They both have the same contents, which is bad. But over here, the only difference is a bubo is something which is more severe than an ulcer. So that is why the D, which is a doxycycline, is given for 21 days instead of 14. And this you treat, bubos you only treat for 3 weeks, whereas the genital ulcer is severe in a case of you treat the partners for 3 months. Over here, bubo you treat the partner for only 3 weeks, but doxy we have increased for 21 days. So that's all the kits.